When we vaccinate, instead of having passive immunity, which of course does decay and does disappear in time, this vaccination provides active immunity. And that active immunity includes antibodies of all the different classes. The one that's most important, again, especially for systemic diseases like distemper and parvo and panleukopenia, it's that IgG antibody again. So I'll talk a lot about IgG mainly because it is the most important of the immunoglobulins for protection against the diseases that we're going to be talking about. The IgA antibody, and especially secretory IgA, is important for mucosal surfaces. So when you vaccinate your dog for kennel cough and you want to get antibody to canine parainfluenza and bordetella, you want to have secretory IgA develop. Not just IgA in the serum, but secretory IgA. And as you will remember, or maybe you won't remember, I said that that particular antibody was resistant to things like the acidity of the gut. Well, it's also very important because of that secretory component that it can act on mucosal surfaces and provide some protection against the upper respiratory tract, which is really what we're trying to protect when we're trying to protect against kennel cough or URI, or what I will often refer to as canine infectious respiratory disease complex, commonly known as kennel cough, or feline infectious respiratory disease complex, or upper respiratory infection, URI. So if I'm using those terms, I'm using them interchangeably, and we're talking about kennel cough or URI. So that's important with regard to active immunity, and we need to really induce that active immunity, because for vaccines like distemper and parvo and adenovirus, that immunity, that active immunity, is going to last for a very long time. And in normal, healthy animals, that very long time is actually the life of the animal. So much like vaccination of children with MMR, measles, mumps, rubella, they get vaccinated at a young age, and generally they never need to be vaccinated again for measles, mumps, and rubella. Similarly, the dog, the MMR of the dog is distemper, parvo, and adeno. And ironically, distemper and measles virus are in the same family, and some of you recognize that we actually use measles vaccines to vaccinate young puppies, because the measles vaccine can actually immunize at an earlier age than the modified live distemper. So measles and distemper are a lot closer than a lot of people really realize. So that's an important consideration with regard to active immunity.
Okay, so everybody should see we have a poll question that just popped up. I'm going to go ahead and read it. This is a poll question for veterinary professionals and shelter professionals. At what age does your organization or practice begin vaccinating puppies and kittens? 4 weeks, 6 weeks, 8 weeks, 10 weeks, or not applicable? This question is for veterinary professionals and shelter professionals. At what age does your organization or practice begin vaccinating puppies and kittens? You see we've got some answers coming in. If you haven't answered yet, please go ahead and answer. Okay, it looks like 18.4% of you selected 4 weeks, 35.2% selected 6 weeks, 19.7% selected 8 weeks, 2.6% at 10 weeks, and 23.8% were not applicable. Thank you. We have another poll question for you. This question again is for veterinary professionals and shelter professionals. How often does your organization or practice re-vaccinate puppies and kittens? Every 2 weeks? Every 3 weeks? Every 4 weeks? We do not re-vaccinate, and not applicable. So again, this question's for veterinary professionals and shelter professionals. How often does your organization or practice re-vaccinate puppies and kittens? So it looks like we're getting some good answers here. If you haven't answered yet, please go ahead and select an answer. We're getting some good answers. We'll just give you another minute to respond. Okay, so it looks like 22% said every 2 weeks, about 28 every 3 weeks, 15 every 4 weeks, and then about 4% said we do not vaccinate. Thank you.
So moving on with regard to active immunity, generally vaccine immunity develops earlier than the time that you can actually measure antibody in the serum. And that's for a variety of reasons. One is antibody will form locally before it gets into the serum and provide protection at various sites where it's being produced. The other thing is there's a variety of other mechanisms that are helping to provide some early immunity. So you don't necessarily have to be able at a particular time show antibody in serum to have protection if the animal has recently been vaccinated. An example of that is that for canine distemper vaccine, we can actually demonstrate that if you vaccinate now and almost as quickly as the animal can become infected, the vaccine will actually help prevent severe disease. It will help prevent neurologic infection, and the animal will very likely survive. There are no vaccines for any species that are more effective than distemper vaccine. So that's something that we need to know as we're actively immunizing. In general, what we say about the timing for the development of active immunity, as I just indicated with distemper, it's almost within hours and certainly within a day after vaccination. It won't prevent infection, but it will prevent severe clinical disease. For parvovirus, if you vaccinate today, 72 hours or 3 days from now, and that would be parvovirus of both the dog and the cat, panleukopenia, you have immunity within 3 days. Now, obviously, the immunity is going to be a little bit better by a week of age, but you will get some protection, and that's important to understand. Now, if canine adenovirus 1, which is the virus that causes infectious canine hepatitis, which fortunately we have pretty much eradicated from the United States through vaccination, but many countries still have that virus. If you were to vaccinate with that, and we do with a CAV2 vaccine, it takes about 5 days to get immunity. So the time from vaccination to protection varies depending on the particular vaccine and the agent, the pathogen, the virus that we're trying to protect against. And it's also important, of course, many of you know that there are many other factors that play a role in terms of protective immunity. They include nonspecific or innate factors such as complement, interferon, number of different enzymes and so forth that provide very rapid immunity. For example, when you use an intranasal vaccine to prevent kennel cough, within just minutes to hours after that vaccine is given, because of the nature of the Bordetella being a nonspecific stimulant of immunity, it's almost an adjuvant or an enhancement of immunity, you'll have things like interferon develop, and that interferon will be able to help that animal resist some viral infections. Cellular immunity will develop in days or weeks. So it's not just the antibody that develops immediately to certain vaccines. It can be nonspecific as well as cell-mediated or cellular immunity.